in Bellasis and I'm a new grad RN in the acute care float pool. I took kind of a unique path to get into nursing. Originally I was a civil engineer, and after a few years of working I realized that wasn't what I wanted to do with the rest of my life, and I decided to go back and become a nurse. And when people ask me, how'd you make that switch? I tell them, I know it's cheesy, but the first time around I chose my career with my head, and the second time around I chose with my heart. And I absolutely love what I do and feel so lucky to do it every day. Starting here as a new grad, it's been a really great opportunity. It definitely was not what I expected, because coming in I thought you just wanted to fit in and do what what people before you have done, and kind of just fill that role. But right away they started asking, look around, see what you think can be improved upon. And so pretty much day one I feel like I'm getting to take that more leadership role of going in and looking for room for improvement. In our new grad class we get to come back every month to talk about it and really check in and brainstorm on how we can change and how we can make things better. So since I'm in the float pool, I get the opportunity to see the 7 different acute care units. And I feel very lucky because I can see, the best things about each unit and kind of try and tie them together and turn it into something that can be used to improve all 7 units. I'm really enjoying that opportunity. I'm loving what I'm doing, and I just feel very lucky to be an RN.
My name is Elizabeth Leachman. I am a nurse practitioner with the Department of Trauma, Burn, and General Surgery. I started out at Children's as a child care technician. When I graduated from college, I applied for a job as a nurse here, the medical care unit, for about 3 years before I decided to go back to graduate school to become a nurse practitioner. I knew I wanted to go to graduate school, and I was pretty sure I wanted to be a nurse practitioner, but I thought it was important to look at the roles that advanced practice nurses played throughout the hospital. So I really paid attention. I involved myself in lots of committees and decided that being at the bedside was what I wanted to do. I think that all of us nurse practitioners in this department are leading change every day. We're constantly trying to think of new ways to educate patients and families as well as each other. We're always looking for new learning opportunities. I would encourage every nurse in this hospital to go back to graduate school and get your master's and continue opening your doors even wider, because there are so many things you can do as a nurse and continue to grow.
I'm Pernick. I'm a new nurse here at the NICU at Children's. I don't really think I ever thought that being here for 4 weeks already thought I was a leader or thought I could impact change, but I'm already seeing all the ways that in the future I plan to do so and how it's already happening. I'm here with a big group of new orientees, and I think that itself is changing parts on the unit, and we have to adapt and be leaders in that sense. And I hope that within my group of peers and other nurses that I can somehow help to make the adjustment to the unit easier and help to kind of transform the way we think about our patients, and as new nurses what we really can do for them. I really hope that nurses don't forget, especially when you're young and new, that you are important and that we can really make change, that just by being there we're helping to change things and we're helping to make the unit better and hopefully make the patient stays better, and by being ready for the changes we can make that even better, I guess, for them.
Hi, my name is Woodside. I'm a nurse here at Children's National Medical Center on 7 East. My prior degree is pre-veterinary medicine with a minor in communications. Years ago, I moved down to the DC area, worked for the National Institutes of Health, fell in love with the nursing profession, then decided to go back to school and got my master's in clinical nurse leadership from University of Maryland, Baltimore. And I know that this was the right career for me, and I have not looked back and regretted it for 1 second. I'm pulling a lot of information and a lot of experiences from my outside life as well as my prior work experiences that I'm bringing into the nursing profession. One of the other things I like to do is use humor. I like to have fun, and I like to kind of make everybody else smile. Every time I come here to work, I always have a smile on my face. I'm trying to inspire my other coworkers to all come in and have a smile as well. The best thing I can do, as far as I'm concerned, is not only to be competent with my nursing care, but to also take the time to sit there and get to know my patients, their families, try and advocate for them as best as I can, as well as try and make their experience as positive as possible. So if I can take the time to make that experience that much better, then I feel satisfied, I know they feel satisfied, and then as a hospital, we can all be, far more satisfied.
Hi, my name is Tosin Oluwole, and I am a part of the acute care float pool. My story begins a long time ago, around when I was 14. I was a chronically ill child. I was diagnosed with Crohn's disease. The first time I knew that I needed to become a nurse was when I met one of my nurses who also had Crohn's disease and helped me through a lot. And I was like, this is what I want to do. I want to make people feel at ease. This is the perfect thing for me. My story has just been using what I've learned and what I've kind of been through as a chronically ill child and bringing that to work with me every day. Just the simple act of putting a mother's fears at ease the night before her child's going to go for a port placement, and explaining to her what goes on, what it's going to feel like, that I too have been through it, to ease their mind. It's actually made everything worth it, everything that I've had to go through worth it. Children's is not in competition with anyone but themselves, and that's what I love about this hospital. I want my name to be a part of that. I have so much pride when I say I work for Children's Hospital. The sky is really the limit, and I feel like Children's going to go past that. And just all of us working together, the possibilities are endless for Children's.
I'm Hannah Hanscom. I'm a clinical nurse on surgical care, and I've been here for almost about 2 years now. And in my 2 years, I've been able to really become engaged in a lot of activities here at Children's National, one being the Magnet Champions. Currently, we're working on a resiliency survey, so we can really increase RN satisfaction, because with increased RN satisfaction, we're going to increase patient satisfaction, and really that's our goal overall, is to take care of our patients. So what we're going to do is we already have done a survey, and we're going to implement something hopefully house-wide, really to improve how we work together as a team and how we take care of ourselves. Also, I'm part of the Pathways to Nursing Care Excellence Fellowship, and within that we're going to be implementing different projects to improve our clinical indicators, which is also going to improve patient-centered care and our patient satisfaction. For me, patient-centered care is my passion. I love taking care of my kids. And so if we can make their stay better and make them feel more comfortable here, and that's the overall goal, and that's what all of us nurses and all of us working here really strive for.